Imagine a healthy and productive workforce with programs in place to prevent and manage the illnesses that tend to keep us away from work. Consider the possibility of having readily available resources to help easily navigate through the complex healthcare landscape. How about a partner to help you design a health plan that incentivizes employees to adopt healthy habits, prevent illness, and manage chronic conditions more effectively? Do you want to offer a health plan designed to reduce healthcare costs for the employee and employer by at least 10%? Well, we've reached out to patients, healthcare systems, and employers to identify the healthcare needs of our community and the state as a whole. As a result, I am pleased to share with you that Aetna, in collaboration with our valued providers, has designed a way to take this from imagination and wishful thinking to a reality every employer and employee can experience.
When faced with a seemingly insurmountable challenge, it makes sense to join forces. This is why the Value Care Alliance, a collaboration of hospital systems, is sharing insight, processes, and resources to deliver consistent, high-quality, and affordable care to the residents of Connecticut. This innovative partnership is made up of Danbury Hospital, Norwalk Hospital, New Milford Hospital, Griffin Hospital, and Middlesex Hospital, as well as St. Vincent's Medical Center. With the addition of similarly capable and like-minded pro-health physicians and Trinity Health of New England, we're now able to cover the state with a network of high-value healthcare providers to serve as the foundation of the innovative Aetna Whole Health product that's the market's best example of value-based insurance design. We all share a common vision focused on managing the cost of healthcare while improving patient outcomes and their care experience. Partnership with Aetna is a best practice initiative we're implementing to give our patients and their employers the highest quality healthcare at a location close to home at an affordable price.
With the new Aetna Whole Health plan, we're looking to save the taxpayers' money, save our employees' money on the premiums, keeping our employees healthier and with less absenteeism, sick days.
Hundreds of billions are spent annually by U.S. employers on hours not worked by their employees. That's right. The cost to organizations of covering medical leave due to poorly managed chronic conditions or lack of care coordination is astronomical. In a world of competing healthcare systems and diverse insurance options, tiers, and plan design types, consumers face the challenge of figuring out who to see, where to go, and what their coverage is to avoid breaking the bank when managing the health and well-being of their family.
With Aetna Whole Health tiered approach, we've got this tier 1 with local providers who provide a greater benefit at a lesser cost to our employees. And that's really worked out great thus far for the City of Derby.
One of the biggest differences for this plan is that as part of a network, these physicians and the hospitals and the emergency rooms and urgent cares are already familiar with each other, even though they're not owned by the same company. There's just this real commitment to being coordinated on your behalf.
Employers can now make a long-term investment in one of their most valuable assets, their people. We're talking about consistent, reliable, and transformational healthcare, where employees are offered tailored programs to help them prevent or manage chronic illnesses, build a trusting relationship with a primary care provider, find affordable medications, and stay out of the hospital.
The members will be exposed to a one-stop shop resolution, which means that if they need help in managing access to healthcare, or if they have a disease or complications of health, they will have a medical professional to help guide them and keep them on their care plan. One-stop shop resolution aids the member in getting and staying healthy, which in turn helps everyone achieve success.
With the Aetna Whole Health Plan, employers are able to offer a value-based healthcare option to their employees instead of the traditional and difficult to navigate pay-for-service approach. Our value-based insurance design uses financial incentives to encourage people to get the right care at the right time from the right provider. Members are asked to choose a primary care provider to serve as their long-term health care quarterback.
They are the ones who are going to be directing your care and making sure that you receive the appropriate care at the right place at the right time.
This relationship enhances communication and continuity of care for your employees and ultimately engages them with a healthcare partner who will navigate their health maintenance needs and improve their overall patient experience while driving efficiency and controlling costs for you. This well-rounded approach to managing costs for the employer and employee is made possible by Aetna and a broad network of high-value providers spanning the entire state of Connecticut. Our goal is to partner with employers to cultivate wellness in the workplace and engage employees to become active participants in efforts to improve their health and well-being. There are real benefits of this enhanced program. Easier to access comprehensive employee health risk assessment to guide effective care plan development, care teams that include a physician and nurse practitioner or physician assistant to improve patient access so getting in to see a primary care provider is faster. Members will receive a gold ID card from Aetna, which will identify their primary care provider, as well as critical plan and network contact information. The gold ID card will also easily identify Aetna Whole Health Plan members when checking into a provider's office. Claims data from your health plan can be analyzed to determine which conditions are most prevalent within your workforce, allowing you to engage in wellness incentives and tailored chronic disease management programs. And we have systems in place to make sure patient information is shared among caregivers, eliminating redundant medical tests and procedures, enhancing communication, and facilitating continuity of care.
By avoiding duplications in services, and then also by making sure that the patients are getting the services that they need, such as diabetic eye exams. If we can get a diabetic eye exam and treat damage to the back of the eye much earlier in the disease, we can save that patient's vision, and we can also prevent lots of costly treatment down the road.
With a focus on preventive care, chronic disease management, managing prescription drugs, and physicians with proven positive results, employers and employees realize unparalleled benefits with the Aetna Whole Health approach. Better employee health, resulting in improved productivity and reduced sick time, with a primary care provider leading the care for every health plan member. Unnecessary or redundant testing and procedures will be reduced. An increase in employee satisfaction resulting from a healthcare plan that offers enhanced resources and less out-of-pocket expense.
Instead of competing against each other and driving up healthcare costs in the process, our member health systems have established a spirit of collaboration and a willingness to share best practices in order to serve health plan sponsors and plan members better. Joining forces with our valued partners has allowed us to be creative and take a smarter and more innovative approach to healthcare delivery to make it more affordable and effective for both employers and their employees. I challenge you to imagine what enlightened, high-value hospitals and physicians working closely with an innovative health insurer can achieve by entering into a partnership with you and your employees to control healthcare costs and improve the health and well-being of your workforce. I encourage you to consider Aetna Whole Health because I believe it is the vehicle that is capable of making these improvements in employee health and well-being possible.